Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about some of the things that you will be learning in medical billing and coding school. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I will start off by saying this. Not all programs are created equally, but the topics that I'm talking about today in these programs are some of the major things that your program should cover, okay? And if it doesn't, then you know what else you need to study on, right? So let us begin. Okay, I will start off by saying this though, also, that a lot of people ask me, Blue, do I absolutely have to have medical terminology, anatomy, and pathophysiology? The answer is yes. You cannot get into this field without having some sort of base foundation of medical terminology, anatomy, and pathophysiology. Reading through medical documentation is not like anything that you will ever do. It is so complex and it can be very confusing even for a very seasoned coder, because adding a word to a diagnosis can completely change the diagnosis, right? So when we think about this, for example, right? Intra-articular. Do you know what this means? So if you know your prefixes, suffixes, and root words, you'll know automatically by the prefix that the intra means that this is inside something. So in this instance, this means inside the joint. So that is what you would think of when you're saying, oh, okay, when you read intra-articular. Well, what if the documentation said that the condition was extra-articular? What does this mean? So extra means like on the outside or surrounding. So you can think of like extraterrestrial or like out of this world. So that is something you can do to help you to understand some of these bigger words. So that is something that is crucial to your development as a medical coder. That is something that you cannot skimp on. You cannot get away with like, oh, you'll learn it along the way. I did have a viewer say that her instructor actually told her that you don't need medical terminology and that you can learn it along the way. That is a very, very not good advice, it's not sound advice. Because if you are really trying to take this field very seriously, you need to prepare yourself. And when it comes to applying for jobs, these employers, if they're going to give you a chance and having no experience, of course, you may have heard you're in for an uphill battle. But if you're in this and you really want to do this, then you'll prepare yourself so that when maybe on that chance that you do get tested, you'll know and you'll be able to shine brightly, and the employer may want to take a chance on you then. So that is something that you got to keep in the back of your head, that all the while you are in school, all the while that you are learning and while you're getting your certification, you need to continue to stay on learning medical terminology. I cannot stress the importance of this enough. And people still ask me the question, is this necessary? Guys, you're going to be reading these words all day long. At a minimum, if you're working 8 hours a day, you're going to be reading 7 hours out of that day. Straight medical terminology and verbiage and medical documentation. You're going to be looking at all that stuff. So the best way to set yourself up for success and to lessen the stress of, gosh, I don't even understand what I'm reading, is to study that medical terminology. Very huge. Anatomy is the same way. There is no knowing medical terminology without understanding anatomy. And then it goes to, there's no understanding anatomy without understanding pathophysiology, because that's the disease process, right? So it's very important that all of these things come together and that you take the time to learn them. And if I know for AAPC, there's the American Academy of Professional Coders and the American Health Information Management Association. Both of these are the major medical coding associations. Now, with AAPC's online medical coding program, they separate the medical terminology and anatomy into a course by itself, and then there's the coding course by itself. So a lot of people will ask, do I have to take that? It's to your benefit. Yes, you can study on your own, and if you want to study on your own, I recommend getting a anatomy workbook and a medical terminology workbook. I do leave some of the links that I recommend in the description box below. They're Amazon affiliate links, so you do not have to click on the link. I always leave the title in the description box so that way you guys can look at it on your own. Or check out some other titles that you may be interested in. Because the one thing about anatomy and medical terminology is it's generally the same. Yes, there are some updates, and yes, there are some new things, but it's not so drastic that an older book won't be able to help you as much as a newer book. So that is just something to know. And all publishers are different, so that's another thing to know. So yes, there is those big three, but absolutely you have to have those. Now, another thing that I want to address before moving on is a lot of times people will say, well, I heard from so-and-so that medical billing and coding is very difficult and I'm going to get frustrated with it. Here's the thing, guys. If you are not speaking to somebody who is a seasoned veteran medical coder, number one, who is actively in the field, because there's a difference between somebody who maybe teaches and hasn't been out in the field for very long, or hasn't been coding in the real world in years. There's a huge difference between a veteran coder who is actually working actively and somebody who is teaching. So there is a huge difference there. So not to say that you shouldn't listen to your teachers, because yes, you should. But if they are saying things that may be like, well, kind of like telling you that it's difficult, it is difficult. But if you're hearing from somebody else who is not a medical coder, and maybe they're in the medical profession, but they're saying, oh yeah, medical coding, it's too hard, it's too difficult, it's boring. First of all, people who do not do this profession or who have never been trained really shouldn't be mentioning what they think to somebody who is interested in it. Okay, that's the first thing. Because the thing is, when you are trying to get into this field, a lot of people have different opinions when it comes to medical billing and coding. If you've never been trained, or if you haven't had a proper trainer, that can also go into maybe a biased opinion. Now, I will say that I am biased. I have said that from the get-go. I am biased. But I also give you guys the real talk. I am going to tell you that it is difficult, but I'm not going to discourage you if that's what you want to do. I'm just letting you know what you're going to be in for. And so a lot of times when you hear from negative people like about the field and they're not coders, or they haven't been coding in a long time, really consider where you're getting your information from before you put a lot of stock into what they say. And they may have well-meaning intentions, or they may have the other opposite. It really depends on who's saying what. But if you're deciding to get into this, then you need to do your research on your own and have it be very objective information that you're getting, not subjective. All right. So doing your research, going to the association websites and really kind of looking at those things is really also going to help you. So moving right along, there is also, you're going to be learning about HIPAA, you're going to be learning about the OIG, and you're going to be learning about the revenue cycle. So the revenue cycle is going to cover all of your billing stuff. Now, as medical coders, even though a lot of us don't do billing, we still need to learn about billing in order to get our credentials. And that is true with both associations, right? Because you don't have to be certified to be a medical biller. They do have medical biller credentials, but it's not necessary if you want to work as a medical biller, because essentially medical billers are processing paperwork. It's on the coders to understand the guidelines and the reasons why we can apply this code or this modifier or that evaluation and management level. It is on us because we have that technical knowledge. So that is something to keep in mind if you are just interested in doing billing. And but again, these courses cover the revenue cycle most times, and it's going to talk about Medicare, Medicaid, those big things and how that runs, because again, we do have to know and understand how these things work, at least the basics of how it works. And then of course you're going to get into the coding part. The coding part being your ICD-10-CM, which is the diagnosis book. That's the one that houses all of your diagnosis codes. There's a CPT book, or current procedural terminology book, and that is the outpatient procedures book. Now, there's also the ICD-10 PCS book, and that is the inpatient procedures book. There's a difference, right? So with inpatient, you're building those codes. They don't come already prepackaged like how the CPT book does. The CPT book, it shows all the codes. They are complete, and it just gives you a description of what this code covers. Whereas with the inpatient side, you're looking at different factors, like what was the approach and basically what was the intent, was this diagnostic, and things like that. So there's a lot of factors that go into that. If you are being trained for the outpatient setting, which most new coders are, unless you are in a program for the CCS, which is a Certified Coding Specialist, the gold standard of medical coding credentials offered with the American Health Information Management Association. If you are with them, right, if you're getting trained on the CCS, then you're going to get trained for both inpatient and outpatient setting, okay? The CCA, or the Certified Coding Associate, also covers inpatient too, inpatient coding. So that is something to know. With the CPC, it does not. It is solely outpatient. So that is something that you should also know. But if you are getting trained in the outpatient setting, you're going to be using the ICD-10-CM, the CPT, and the HCPCS book, HCPCS Level 2. Now that is a book that covers all of the durable medical equipment and a lot of the bandages and just different services that are either not described in the CPT book, or perhaps the insurance company wants the HCPCS code instead. So there's always different factors into that. I did do a video talking about the HCPCS book on Friday. I will leave that link in the description box below if you want to check that out. But check out last week's videos where I had plenty of hands-on flipping through the book, where I'm showing you guys my choice of the books that I like. I happen to like Optum 360 coding books. I do use the AMA, or the American Medical Association CPT manual, okay? So there's different kinds, but when it comes to what I prefer, I did do those videos on those. So I hope you guys check those out if you are interested in knowing, understanding, like what else about medical coding and what kind of books do you need. So another question to address is, if you are wanting to do this and you are wanting to do independent study, I did do a template of the courses that you should self-study on. And I did make a whole list of all the books that you need if you want to go this route on your own. And the template is there, and it's telling you like how much time to spend. And of course, if you've already had some of this stuff, it's totally fine. You can go to wherever you need to learn. And it's just a suggestion. This is not anything official, but it is just a suggestion, because you can self-study for the CCA or the CPC. So that is an option if you want to skip out on all of the all of the trade school stuff. You can learn this on your own. You just have to have really good discipline. And again, in the description box of that independent study video, I have the whole schedule. And if you follow it through and through, it will take you 1 year. You can make it through in 9 months, but I really don't recommend trying to go faster than that. Especially if you feel like you're not catching on to things. You perhaps do need to take the time to slow down and absorb some of that material, because it is a lot of reading. And even when you are in school, there's no guarantee that the instructor is actually going to be hands-on with you. They are going to tell you to read. That's really all this field is a lot of reading. I talk about some of the other things that medical coders do, like education and things like that. But when it comes to the bulk of what we do, it is reading. So getting used to it now and getting to where you're going to be comfortable with it is what you want to do, because it's eventually going to be your reality. And a lot of people will ask me, is this field boring? It can get monotonous if you are in a monotonous clinic. But for the most part, if you're always willing to challenge yourself, trust me, there is always going to be a challenge out there. And for me, I code in a specialty clinic. I code 2 specialty clinics. I code for orthopedics and podiatry. Now, I didn't learn about orthopedics and podiatry in specifics when I was in school, because I got the general broad understanding of everything, right? You get it broken down into the chapters, and you code a little bit here, code a little bit there. But getting more specialized in whatever specialty you like, particularly, is a personal thing that you can do, and there are some credentials for it, but it is really not necessary. Okay, when you think in terms of what credentials to get, you want to think about the things that are going to enhance your name and not be like just filler credentials, essentially. And not to put it like that, but it's true, right? When you are adding on a bunch of different credentials, you need to make sure that it's for things that are going to benefit your name. Like if you are wanting to do clinical documentation improvement, that is something that's going to improve your name. You know, if you're saying that you code both inpatient and outpatient, that's going to improve your name. But all you really need is just one credential. That's it. And I've known many coders who have only one credential and they lead very successful careers. So that is something you guys should be aware of when you're trying to take on all these additional credentials. But getting back to the topic at hand and some of the other things that you're going to be learning, you're going to learn some of the basic computer stuff. Like in my program, I had the Microsoft Office set up, right? So if you don't know how to use basic Microsoft Office suite like Outlook, Word, Excel, PowerPoint, if you don't know how to do it and you're doing independent study, there are tons and tons and tons of videos about it on YouTube. So you can look up tutorial videos to help you with those things if you feel like you're going to get stuck, right? But that's just another option if you're looking into doing those kinds of things. So, and it's something that you may learn in school. It really all depends on the program. And now I've heard of some people who go to the college programs for medical billing and coding, and they have them adding on all of these other classes like public speaking or, you know, something along those lines, or some other elective that is not related to medical coding. So again, it really depends on what your program entails, but really the basics that you really need while you are in school is learning about HIPAA, OIG, and the revenue cycle, learning anatomy, physiology, anatomy, pathophysiology, and medical terminology, and then of course learning which manuals you're going to be working with. Okay, on the outpatient side, again, it's going to be the ICD-10-CM, the CPT, and the HCPCS. And if you're studying for the inpatient side, it's going to be ICD-10-CM, it's going to be ICD-10-PCS, and the HCPCS, the HCPCS manual as well, because HCPCS is used in both the inpatient side and the outpatient side. So another something to know. So anyway, I'm going to go ahead and wrap this one up, but thank you guys so much for joining me. If you hadn't had a chance to, I hope you'll hit that subscribe button. I am less than 100 to hit 10,000. I cannot wait, you guys. I am super excited for this, and I am very grateful and so thankful to everybody who has already subscribed. So if you haven't already, do so, and hit that notification bell so that you don't miss out on anything. Give this a like, please, and if it helped you, I hope that you'll share it so it can help somebody else. And I will see y'all next time. Bye.